Coming to the azole group of antifungals, these inhibit 14 alpha demethylase enzyme and they eventually inhibit the ergosterol synthesis. Unlike the amphotericin B, azoles are fungistatic, so they do not kill the fungus, but they will control their replications. So why we use azoles are actually the frequently used antifungals. Now, even though they are fungistatic, they do not kill the fungus. Why are we using them more frequently is because of availability of oral formulations. The broadest spectrum antifungal amphotericin B is only available in IV formulations, but azole drugs are available for oral formulations. As we have discussed earlier, they are metabolized in the liver and their dose needs to be decreased in hepatic failure. And these are the preferred antifungals in renal failure. But the IV formulation of these azoles are not used when there is renal failure. The reason is the IV formulations contain cyclodextrin, which is not excreted in renal failure. So do remember this. Even though azoles are the preferred antifungals in renal failure, the IV formulations are given with caution due to the presence of this compound cyclodextrin. Now, these are the five azoles which are mainly used in the clinical practice. The spectrum of activity is lowest for fluconazole and it is highest for posaconazole and isavuconazole. Posaconazole and isavuconazole are even effective in the treatment of mucormycosis. Coming to the fluconazole, the advantage of fluconazole is it has the best CNS penetration and also has the best penetration in other body fluids like urine, CSF, and eye. The side effects of fluconazole include alopecia, dry mouth, and metallic taste. Now, in pregnant individuals who use topical fluconazole for vaginal candidiasis have high risk of stillbirth and miscarriages. So, they should not be used in pregnancy, even in the topical form. Coming to the itraconazole, it has poor CNS penetration and it has a broader antifungal activity and used in the treatment of histoplasmosis and blastomycosis. It is a potent liver enzyme inhibitor, especially 3A4. So it will increase the levels of drugs that are metabolized by 3A4. And it is contraindicated in patients with heart failure as it is cardiotoxic. Next, coming to voriconazole, it has again good penetration to many of the tissues and it is mainly used in the treatment of aspergillosis and scerosporiosis. It has a unique side effect profile and it includes photosensitivity and increased risk of skin cancer. And it has another unique side effect called fluorosis associated periosteitis. So please do remember the side effects. It can cause photosensitivity, skin cancer, and fluorosis associated periosteitis. One more thing about itraconazole and voriconazole is they require frequent blood level monitoring, but the reasons are quite different. Itraconazole requires frequent monitoring because there is variable absorption in the intestine. So in one person it is absorbed more, in other person it is absorbed less. So it requires frequent monitoring. Voriconazole is metabolized by one enzyme 2C19, and there are genetic polymorphisms which will lead to increased levels of activity of this enzyme in one person and decreased level of activity of the enzyme in other persons. So it requires frequent monitoring, and these genetic polymorphisms are also tested if necessary. Coming to posaconazole and isavuconazole, these are the only two azoles which have activity against the mucormycosis, and they have relatively less side effects. Posaconazole has one unique side effect, that is posaconazole induced pseudo hyperaldosteronism. Posaconazole is mainly used in prophylaxis of fungal infections in neutropenic patients, and it is also FDA approved for this indication. So these are the main points about antifungals.